Hi everybody, Trevor Petrie, certified hand therapist here, once again coming to you live from my car. I am going to talk today about tennis elbow, also known as lateral epicondylitis. And basically it's a very common tendonitis that occurs at the elbow. The spot that it occurs specifically is right here. Right at that side of your arm at this point, and it is the attachment point of a tendon that runs right up here, right to this part of your wrist, right here like that. And it's usually a very sharp pain. Sometimes it can be a little achy. Every once in a while it can radiate a little bit around there, but the center of that point of pain is right at this point. That is an attachment for that tendon that moves that wrist up like that. There's a couple other things that could be going on at that point if you have pain sort of in that area, but this doesn't look like a very familiar point, or you're having trouble pinpointing what it is. The second most common thing that might be going on right there is called radial tunnel, and that's when you get this radiating pain right around in this spot right here. You have a nerve that comes through there, and you also might have some aching in the wrist right here, and maybe even a little bit of aching or burning or numbness and tingling on the back of your hand, particularly in the area of these three fingers right here. But today, tennis elbow is our subject. And that's what it is. So how does it happen and what do we do about it? Any tendonitis just means inflammation of a tendon. And so what happens is we irritate a tendon. It becomes a little frayed. There's a little bit of micro trauma to it. Over time it gets a little bit worse until eventually our body starts registering pain. Unfortunately, this tendon in particular is really bad at healing itself. It's got very bad blood supply. The biomechanics of that whole area don't really lend it to being able to be rested very easily so that it can heal. We use our arms obviously for a lot of different things throughout our day. And so it can be a tough one. Research shows us that left to its own devices, the majority of tennis elbows tend to get better on their own in 9 months to a year and a half. And that really depends on which paper you're reading and who's trying to get published that week. But that's a pretty long time to be putting up with this, especially if it's a fairly debilitating pain that keeps you from doing a lot of things you love to do. So I'm going to give you some tips for how to maybe accelerate that process a little bit. The first step is if it's a very acute, very painful tendonitis that hurts no matter, even if you look at it sideways, the first thing you want to do is figure out how best to give it a little bit of a break and give it a rest. The easiest way to do that is just a wrist cock-up brace, something that kind of goes around your wrist and controls motion. That way you don't do this motion here that activates that tendon back here. Find the one that fits best for you and fits into your life the best that you can wear. They make big old honking ones that really don't let you move at all, and then they make smaller and smaller ones to the point where maybe it hardly feels like it's doing anything. Generally I like to find something in between. And the reason for that is, and that takes me to my next step, is that the research shows us that whenever you have a tendonitis, what you want to do is you want to find the appropriate amount of load, right? So the appropriate amount of stress is very important to healing a tendon, any tissue really. Sometimes the appropriate amount of load or stress is no load or stress. You just have to give it a break, let it heal. Those of you that have seen some of these videos before know that that's kind of a theme that I come back to a lot, is what is an appropriate amount of stress. Unfortunately, there's no easy answer for that, and that's something you kind of have to start listening to your body to figure out what makes it angry, what makes things worse, versus what seems to calm things down a little bit. And so with the tendonitis, what you want to do is you want to find the things that allow it the right amount of rest, but also give it just a little bit of stress, a little bit of motion. The nice thing about a wrist cock-up that maybe gives you a little bit of motion is you're still using that arm functionally, so you're still reaching out, you're still crossing, you're still extending that elbow. When that elbow moves, you're stressing that tendon because that tendon crosses across that joint there. So even if your wrist can't move at all, you're still moving that elbow around and creating just a little bit of stress. If you're not in a position where you can wear a wrist cock-up brace or a splint like this, those tennis elbow straps can be helpful. And what you want to do is you want to wear it so they're about 4 or 5 centimeters down from that that bone where that pain is, over those muscle bellies right there. And you want to just give it enough of a squeeze so that when you contract those muscles, that muscle can't fully expand and give it a full contraction force. And that's what limits the stress that you're putting on that over there. My new moms, nurses, sometimes mechanics, people that just have to get things done, I'd rather have them wear a tennis elbow strap rather than get frustrated all day and tear the wrist splint off, and then it's not doing anything. Oftentimes I give out both, and I'll say, listen, if you're doing something where this is just getting frustrating, take the splint off, put the elbow strap on, and then at least wear it when you get home or at night, because I feel, and this is largely anecdotal, it's backed up a little bit in the research, but those wrist cock-up splints seem to do a better job of slowing people down and giving that tendon a little bit of a break. Now, what you want to do in the meantime, heat and ice. Heat if you're stiff, ice if you're sore. I'll say that again. Heat if you're stiff, ice if you're sore. That is the general rule of thumb I follow for most use of heat and ice for an injury. Heat's going to get more blood flow to the area, so that's going to relax things out. It's going to increase tissue elasticity so that tendon can stretch a little bit more without creating more trauma. Ice has the opposite effect. It constricts all those blood vessels, so those inflammatory agents can't make it to the area and keep that spiral going over and over again. Sometimes, every once in a while, someone really gets a good relief from ice when I think it's going to be heat, and vice versa. And I always default to listen to your body. Always, always listen to what your body's telling you above and beyond whatever I'm telling you or your doctor or therapist telling you. And communicate that with them, and hopefully whoever you're talking to or reading about will be able to sort of tailor something specifically for you. Not everyone's made the same. Not everyone reacts to heat and ice and stretch and all that kind of stuff the same. So resting it with a splint, using heat and ice as needed, and whichever one feels better, but generally speaking, I'd say 99% of my patients prefer heat when they're stiff, ice if they're sore. It makes the most sense to me when you're talking about the physiology of what ice and heat do. And now exercises, being proactive. What can we do about it? Well, directly for this, I've got 2 big exercises that I give everyone on the first day that I see them. And one is just a very gentle wrist stretch. And sometimes if it's really, I'm going to sit up a little taller in my chair. Sometimes if it's a very acute case, just really nice and easy, maybe giving a little bit of stretch with the other hand, keeping that elbow flexed, and I'll usually have it down by my side right here like this. Sometimes that's enough. Sometimes that's all the stress you can tolerate there. Don't get to the point where you're gritting your teeth. Before we were all wearing face masks, I said a little bit of the Elvis face is okay. A little bit like, this is uncomfortable, but it's not the worst thing I've ever done. You don't want to make the Popeye face. You don't want to be doing this while you're doing your stretches, because that's probably just irritating it and creating more trauma. As you can tolerate more, you can start extending that elbow out and getting a little bit more and a little bit more, just like that. You can kind of rotate that forearm around, find that spot that feels nice to stretch, right? This should all feel like, okay, I can feel that a little bit. It should be maybe a little bit tender, but not to the point, again, that you're going to be angry in, 15, 20, 30 minutes, right? If you overdo it, put some ice on it, give it a break, put your brace on, your strap, whatever feels nicer, and maybe even do a little bit of massage there, cross friction massage. People say you do it to get blood flow to the area. Honestly, I am more of the mindset that it just kind of feels nice, helps calm it down. So just kind of back and forth just like that. You can do little circles there, whatever feels best. And the other exercise I give to people is called a bell sole, and so it's a grip. So sometimes I'll have people use a sponge or a squishy ball, something that can squeeze, but you can do it without anything. You're just gonna hold it right by your side, and I gotta sit up real high. Hopefully my phone doesn't fall over. You hold it right by your side, just like this, without over your head in the ceiling, and you're just gonna open and close your hand, just like so. So I'm gonna hold it up so you can see, just like that. And you can kind of see those tendons firing as I'm doing that, right? All right, again, we're just creating stress. We're not strengthening. Okay, if it hurts back there, then don't use so much force, right? You're not trying to crush something's will to live in your fist there, all right? Especially if you have a squishy ball or a tennis ball or a washcloth in your hand, okay? You're gonna do gently, and I'll use the term submaximal effort, right? Just enough so that you can maybe feel a little bit right there. You're gonna do 5 in this position with your thumb up. You're gonna do 5 with your palm up. And that might be a little bit less tolerant of force, so be careful with all of these. Just a nice, easy pace, just back and forth. And again, these are all going to be right by your side right here. But I have to do it like this so you can see me. And then palm down 5 times right there. And again, you can have a sponge in your hand, a washcloth, a tennis ball, whatever feels good. Or you can just kind of do it open and close, just like that. But just enough so you can feel it. Stress, good. Pain, bad. That's how I boil it down for people. Stress is good. It's how your body adapts. It's how that healthy portion of that tendon gets thicker and stronger and able to resist the forces we want it to resist. It's how we calm down that neural system that's creating pain for us. But pain is just exacerbating it. It's just keeping that cycle going. So stress is good. A little bit is good. A lot of it is not good. You don't want to try to kill something. Okay. So splinting, so give it a rest when it needs to rest. Control the stresses you're putting on it. Sometimes no stress is best. Heat when you're stiff, ice when you're sore, usually, but some of you out there might feel better with ice all the time or heat all the time. Do whatever feels best. If it feels good, you'll move better. If you move better, it'll heal better. And then gently stretch it, or do those little easy grip things just like that. There are a ton of videos on YouTube with different things you can do to stress that tissue. There's all kinds of theories out there as to what kinds of stresses are best, what kind of exercises. If they're trying to sell you a product, they'll probably tell you it works 100% of the time. Never, in my experience as a therapist, have I seen anything that works 100% of the time for 100% of my patients. But you can kind of read the reviews and see what seems to work best for you. Sometimes I use a flex bar, those little they're little red rubber bars you can twist. They have a specific exercise they like to kind of package with that for tennis elbow. Other things to look at. If you work in front of a computer a lot, I'm getting a lot more tennis elbows into my office right now. And one of the things to look at is, what's your ergonomic setup like at home? Are you just on a laptop on your lap like this? And then all of a sudden your elbow starts to hurt, okay? Start standing up, start doing some shoulder rolls, start reaching out, okay? Mini breaks. If those of you that have a job where you're in front of a computer all day and your elbows are starting to flare up, stand up, walk around, do some nice easy stretches. Do that before it becomes a big thing. If you start getting a little bit of discomfort there, start doing some more stretches. And that just means 30 seconds, maybe every hour or two if you take a break. And get out of whatever posture is causing you difficulty. Great. Not everyone can afford a stand-up, sit-down desk and screens that are the right size for a good ergonomic setup at home. We're just trying to make it through until we can go back to our office. If you can afford it, I love sit-to-stand desks for any kind of repetitive stress. It gets you out of a single posture. Of course, that only works if you change it every once in a while throughout the day, so making sure you're doing that. So at the end of the day, a couple take-homes. Okay. Tennis elbow, specifically right here. If there's a lot of radiating symptoms going around all over the place, there might be something else going on. Either that nerve that goes through here, or maybe some of the nerves, or there's an impingement going on up your shoulder and neck that can also manifest down here. Tennis elbow is basically right there. Stress good, pain bad. Sometimes a good amount of stress is no stress. A splint can help you control that. Either a wrist splint, which is my preferred method, or if you cannot have a splint on for whatever reason over your hand and wrist during the day, then a tennis elbow strap. I've had people work with that. If you've got a little bit of nervy stuff going on there, be careful with those elbow straps, because those can kind of irritate that a little bit. And then different exercises to stress that tissue appropriately. We've got just gentle forearm stretches starting back here and just kind of stretching it out. And then as you can, just slowly start to extend that elbow out to get a nice big stretch through here. And then you've got those bell sole exercises, those open and close of the hand. Again, you can kind of see that tendon firing as I'm doing that. Okay, and just always remember, stress is good, pain is bad. We're not strengthening. If you're using a sponge or a tennis ball, don't try to crush it. And when it comes to a home ergonomic setup, if there's something that's changed, look at what your positioning is. Think about what might be specifically irritating and see if you can either alter that thing or just take a break. Every once in a while, stand up, change your posture, change your situation, and see if that will help offload those structures. Hopefully that helps. Hopefully that gives you some pointers. If you want to leave some questions under the video, I'll be kind of lurking around on the Grace Enable Facebook page, or you can also post over on our hand pain support group Facebook page. Hopefully I can get back to any questions you might have. But otherwise, stay healthy, keep moving, and be kind to yourself.